Imagine this. You're sitting at home, surrounded by the comforting hum of daily life, when you receive a call that shatters everything. It's from your doctor. You've been experiencing headaches, dizziness, and an unexplainable sense of fatigue for weeks. But you brush them off as stress or lack of sleep. After all, you've been juggling work, family, and everything else life throws at you. Who has time to listen to their body when the to-do list keeps growing? But this call isn't just any call. It's a wake-up call. The test results came back, and they aren't good. The quiet symptoms you ignored, thinking they were nothing more than the everyday grind, have now evolved into something far more serious. Something that could have been prevented had you paid attention earlier. This isn't just a hypothetical scenario. It's a reality that happens to thousands of people every year. People just like you, who thought they had time to get around to that checkup, time to listen to the subtle whispers their bodies were giving them. But by the time the alarm rings, it's too late. You might think it won't happen to you. But what if it does? What if the signs you're ignoring today are the ones you'll regret not acting on tomorrow? Why pancreatic cancer is a silent killer. Pancreatic cancer is often called a silent killer, a phrase that reflects its deceptive nature. Unlike other cancers that may come with clear symptoms like weight loss or pain, pancreatic cancer often goes unnoticed until it's already reached an advanced, potentially fatal stage. The reason for this lies in the very biology of the pancreas itself. The pancreas is a small yet incredibly important organ located behind the stomach. Its role is essential to digestion and blood sugar regulation. It produces digestive enzymes that help break down food in the intestines and insulin, which helps control blood sugar levels. In the early stages of pancreatic cancer, tumors often form the cells responsible for producing these enzymes, known as exocrine cells. Because the pancreas is deep inside the body and has no direct connection to the surface, symptoms of the disease are slow to emerge, if they appear at all. This stealthy nature is part of what makes pancreatic cancer so dangerous. Early-stage tumors are small and don't press on any nearby structures or nerves, meaning there's little to no pain or discomfort. Symptoms, if they do manifest, are often vague, unexplained weight loss, vague abdominal discomfort, or digestive issues that can easily be dismissed as something else. Even when symptoms are noticed, they are typically subtle and can be linked to other, less serious conditions. As the cancer progresses, it begins to spread to other areas, making the symptoms more pronounced. But by this stage, the disease may have already spread to nearby organs, such as the liver or lymph nodes, making treatment more difficult and less effective. The fact that pancreatic cancer can develop without showing noticeable symptoms until it's already advanced is what makes it a silent killer. This delay in detection is what causes so many people to ignore or underestimate the significance of minor health changes, just as we saw earlier with a person who brushed off fatigue and headaches. The danger with pancreatic cancer is that by the time you notice it, time may already be running out. Quick preview of the 6 shocking symptoms. You might think you'll notice pancreatic cancer in its early stages, but the truth is, the signs are often so subtle that by the time they're recognizable, the disease has progressed significantly. These 6 symptoms are often overlooked, yet they may be your body's way of warning you. Unexplained weight loss, persistent abdominal pain, jaundice, digestive problems, new-onset diabetes, and fatigue. In the next section, we'll dive deeper into each one, so you can start recognizing the early warning signs before it's too late. Symptom 1: unexplained weight loss. One of the most alarming, yet frequently overlooked, signs of pancreatic cancer is unexplained weight loss. This symptom can seem harmless at first, especially in a world where weight fluctuations are common and often attributed to stress, diet, or a busy lifestyle. However, when the weight loss is rapid, unintentional, and without any clear cause, it's a signal that something more serious might be happening. Something that could involve your pancreas. The pancreas plays a critical role in digestion, breaking down fats and proteins from the food we eat. When a tumor develops in the pancreas, it can interfere with the organ's ability to secrete digestive enzymes. This can result in malabsorption, meaning that your body is unable to properly digest and absorb nutrients from food. As a result, even though you might still be eating normally or even more than usual, your body is not getting the nutrients it needs. This lack of nutrition leads to unintentional weight loss, a common symptom of pancreatic cancer. The weight loss associated with pancreatic cancer is often not just due to loss of body fat. The body begins to break down muscle tissue as well, which can make the weight loss appear more dramatic. This can lead to feelings of weakness, fatigue, and a general sense of being unwell. The issue, however, is that weight loss is a symptom that can easily be dismissed, especially when combined with stress or other lifestyle factors. Many people might chalk it up to being too busy or not eating properly, not realizing that it could be an early warning of a far more serious condition. Unexplained weight loss should never be ignored, particularly when it's accompanied by other subtle symptoms like fatigue or changes in digestion. If this happens to you, it's time to consult with a healthcare professional. Symptom 2: abdominal and back pain. While weight loss might initially raise concerns, another sign that should never be ignored is abdominal and back pain. Pancreatic cancer is notorious for causing a dull, persistent ache in the upper abdomen, sometimes radiating to the back. Unlike the occasional stomach cramps or tension you might experience from stress or digestive upset, this pain feels different, more constant and deeper, often intensifying after eating. The pancreas is located behind the stomach, which means that as tumors develop, they can press on surrounding organs and nerves, leading to this unique pain pattern. The pain typically starts in the abdomen, near the upper stomach, and may spread to the back. It often worsens after meals, particularly fatty ones, as the pancreas works harder to produce digestive enzymes. This connection to food can make the pain seem like it's related to indigestion or overeating, but the truth is far more serious. What makes this type of pain so insidious is its subtlety and gradual onset. Early on, it may not be sharp or severe, which makes it easy to dismiss as normal discomfort. You might think it's just bloating from a large meal or a result of stress. However, as the tumor grows, the pain doesn't ease up, and its persistence becomes more concerning. Unlike typical stomach aches or back pain that can be alleviated with rest or over-the-counter medications, this pain is relentless. It's a sign that something is affecting the organs inside, and the longer it's ignored, the more invasive the cancer becomes. Abdominal and back pain related to pancreatic cancer is not just uncomfortable. It's a warning sign that should prompt immediate attention. If you experience this persistent ache, particularly if it worsens after eating, it's time to consult a doctor. The longer you wait, the more challenging it becomes to treat. Symptom 3: New-Onset Diabetes or blood sugar changes. Another alarming sign of pancreatic cancer that often goes unnoticed is the sudden onset of diabetes or significant blood sugar fluctuations. While diabetes is a common condition, its appearance in someone without a history of the disease is cause for concern. This is especially true if you notice unusual spikes in blood sugar levels, increased thirst, frequent urination, or unexplained fatigue, symptoms that are linked to the body's inability to regulate insulin properly. The pancreas plays a pivotal role in controlling blood sugar levels by producing insulin, a hormone that helps the body use sugar for energy. When pancreatic cancer develops, tumors can interfere with the pancreas's ability to produce insulin effectively. This disruption can lead to what's known as new-onset diabetes, a type of diabetes that occurs suddenly in individuals who previously had normal blood sugar levels. In fact, some researchers believe that new-onset diabetes may be an early indicator of pancreatic cancer, particularly when blood sugar levels become difficult to control despite efforts to regulate them. The connection between pancreatic cancer and blood sugar issues is not always immediately clear. You might find yourself gaining weight, feeling unusually thirsty, or experiencing frequent urination, all common symptoms of diabetes. However, when these symptoms arise out of nowhere, without any family history of diabetes, they may signal something more troubling. For many, the sudden onset of diabetes is mistaken for simple aging or lifestyle changes, especially if it occurs in someone over 40. But the presence of pancreatic tumors can make the pancreas less effective at producing insulin, leading to significant blood sugar irregularities. If you find yourself struggling with unexplained blood sugar spikes or the onset of diabetes after years of normal health, it's time to seek medical advice. Don't wait for the symptoms to worsen or become more difficult to manage. Early detection could make a critical difference. Symptom 4: jaundice, yellowing of skin and eyes. One of the most visible and unmistakable signs of pancreatic cancer is jaundice, a condition where the skin and the whites of the eyes turn yellow. While jaundice itself can be caused by several conditions, when it appears suddenly or without an obvious explanation, it should be taken as a serious red flag, one that may indicate pancreatic cancer. The liver plays a central role in filtering waste product from the blood and producing bile, a substance that helps digest fats. The bile is stored in the gallbladder and released into the small intestine when food enters the digestive tract. However, when a tumor grows in the head of the pancreas, it can block the bile duct, which is responsible for carrying bile from the liver to the intestines. This blockage causes bile to build up in the liver and subsequently leak into the bloodstream, which leads to yellowing of the skin and eyes, what we know as jaundice. Jaundice is often one of the more noticeable symptoms of pancreatic cancer, and can be accompanied by other signs like dark urine, light-colored stools, and itchy skin. The yellow tint to the skin and eyes may start out subtle, gradually worsening over time as the bile buildup increases. Because jaundice is so apparent, it's one of the few symptoms of pancreatic cancer that cannot easily be ignored or attributed to something else. If you notice any changes in the color of your skin or eyes, it's crucial to seek medical attention right away. Jaundice often signals a blockage in the bile duct, and if left untreated, the cancer could spread further or lead to additional complications. While jaundice doesn't always mean cancer, it's a serious warning sign that shouldn't be brushed off. Symptom 5. Digestive issues, nausea, indigestion. Persistent digestive issues, such as nausea, bloating, and indigestion, may seem like typical symptoms of a heavy meal or stress. However, when these gastrointestinal GI issues become chronic and unexplainable, they can signal something far more serious, such as pancreatic cancer. It's important to understand how these digestive disturbances differ from routine indigestion and why they require closer attention. The pancreas plays a crucial role in digestion by secreting enzymes that break down fats, proteins, and carbohydrates. When a tumor forms in the pancreas, it can interfere with production of these enzymes, leading to a host of digestive problems. The most common symptoms include persistent bloating, nausea, and steatorrhea, fatty, foul-smelling stools that float due to undigested fat. These signs may seem minor at first, but they often indicate that the body isn't processing food properly, which is a red flag that shouldn't be ignored. Unlike the occasional indigestion you might experience after eating a large or rich meal, the digestive issues associated with pancreatic cancer are persistent and occur without a clear cause. You may find that even after eating normal, healthy meals, you still feel full or bloated, or that you experience nausea regularly. This discomfort can worsen over time and lead to more severe symptoms, such as vomiting or weight loss, as the body struggles to absorb nutrients. Another key difference is the presence of steatorrhea, which is not common with routine indigestion. When the pancreas is unable to release sufficient digestive enzymes due to a tumor, the body cannot properly break down fat. This leads to the appearance of greasy, floating stools, which are difficult to ignore. If you experience any combination of these symptoms, especially over a prolonged period, it's crucial to seek medical advice. Ignoring persistent digestive issues can delay the diagnosis and treatment of a condition that requires immediate attention. Symptom 6. Dark urine and fatty stools. By now, you may have recognized some warning signs of pancreatic cancer, such as weight loss, abdominal pain, or nausea, that shouldn't be overlooked. However, there are 2 additional, often subtle symptoms that may not immediately be linked to something serious, but should certainly raise a red flag: dark urine and fatty stools. These signs are often connected and arise when the bile flow from the liver is disrupted, as happens when a tumor in the pancreas blocks the bile duct. The bile duct is responsible for transporting bile from the liver to the small intestine, where it helps digest fats. When a pancreatic tumor blocks this duct, bile is no longer able to flow properly, causing a buildup in the liver. This buildup leads to a change in the color of urine, making it appear darker than usual, often resembling iced tea or cola. The dark urine is a result of excess bilirubin, a substance produced during the breakdown of red blood cells, which the liver normally processes and excretes through bile. When bile is blocked, bilirubin accumulates in the bloodstream and is then filtered out through the kidneys, darkening the urine. Along with dark urine, you may also notice a change in your stools. Fatty stools, also known as steatorrhea, are often pale, foul-smelling, and float in the toilet due to undigested fat. This happens when the pancreas is unable to release enough digestive enzymes to break down fats, causing them to pass through the digestive system without being absorbed. The result is stools that are not only abnormal in appearance, but also difficult to flush. Both of these symptoms, dark urine and fatty stools, are a serious concern. Doctors take them seriously because they point to a blockage in the bile duct, which may be caused by a tumor in the pancreas. If you notice either of these signs, it's essential to seek medical attention immediately. Early detection can make a critical difference in the prognosis of pancreatic cancer. Real patient stories, regrets, and missed signs. Stories of patients who later face the harsh realities of pancreatic cancer are often filled with regret. Regret for not taking early symptoms seriously or for dismissing them as something less significant. These stories serve as a sobering reminder of how easily we can overlook warning signs when they seem too vague or unimportant. Take Sarah, for example, a 52-year-old woman who started noticing unexplained fatigue and mild abdominal discomfort. Over the course of several months, the symptoms grew worse, but she brushed them off, attributing them to the stress of work and family life. It wasn't until she started losing weight without trying and began experiencing persistent back pain that she sought medical advice. By then, the cancer had spread to her liver, and her chances of successful treatment were significantly reduced. Sarah often reflects on how she ignored her body's signals and wonders if things could have been different had she acted sooner. Then there's Mark, a 61-year-old man who developed jaundice after a bout of what he thought was a stomach virus. His skin and eyes turned yellow, but he dismissed it as nothing more than a temporary issue. He continued working, and even when he experienced darker urine and digestive problems, he assumed it was related to his age and diet. By the time he was diagnosed, the tumor in his pancreas had spread, leaving little room for effective treatment. These stories aren't unique. Many people miss the early signs of pancreatic cancer because they seem like something harmless or temporary. But by the time the cancer is diagnosed, it's often too late for a simple fix. The importance of recognizing symptoms early cannot be overstated, and Sarah and Mark's experiences highlight the life-changing consequences of delay. Why early detection matters and diagnostic steps. When it comes to pancreatic cancer, early detection is a key to improving survival rates and treatment outcomes. Because pancreatic cancer often doesn't show clear symptoms until it's in its later stages, it's crucial to act quickly when warning signs do arise. The earlier the cancer is detected, the more options there are for treatment, and the better the chances for a positive outcome. The diagnostic process typically begins with a physical examination and an in-depth review of your medical history. From there, doctors will recommend imaging tests, such as a CT scan or MRI, to get a closer look at the pancreas and surrounding organs. These scans can help identify tumors or unusual masses, even in the earliest stages of cancer. Additionally, blood tests, such as a CA19-9 test, can reveal elevated tumor markers that may indicate the presence of pancreatic cancer, though these markers aren't always definitive. In some cases, doctors may also recommend an endoscopic ultrasound (EUS), which uses sound waves to create detailed images of the pancreas. This procedure can also be used to obtain biopsy samples if a tumor is suspected. By collecting tissue samples, doctors can confirm the diagnosis and determine the cancer stage and spread. Early-stage pancreatic cancer is often localized and may be operable, but this is only possible if the tumor is detected before it spreads to other organs. The importance of early detection cannot be emphasized enough. Studies show that the survival rate for pancreatic cancer is significantly higher when caught in its early stages. While the overall 5-year survival rate for pancreatic cancer remains low, early diagnosis offers the possibility of surgery, targeted therapies, or clinical trials that can extend life and improve quality of life. Catching the disease early gives you the best fighting chance. How to advocate for yourself. Questions to ask your doctor. When faced with concerning symptoms, one of the most crucial steps you can take is to advocate for yourself during medical visits. Pancreatic cancer is often missed or misdiagnosed because its symptoms overlap with other, more common conditions. So, When you notice persistent signs like unexplained weight loss, abdominal pain, or digestive disturbances, it's important to ask the right questions and demand a thorough evaluation. Start by being clear about your symptoms and the duration of their onset. I've been experiencing frequent bloating and nausea for the past few months, and it's not improving. What could be causing this? This sets the tone for a deeper investigation into potential causes. Then, ask about specific tests. When ultrasound or CT scan be necessary to rule out any issues with my pancreas? It's essential to know if imaging studies are being considered to check for any abnormalities in the pancreas. Don't hesitate to inquire about the possibility of a blood test or endoscopic ultrasound, particularly if you're dealing with jaundice or digestive changes. Could we test for elevated tumor markers, or is an endoscopic ultrasound option? If your doctor dismisses these suggestions, it's vital to press for answers and alternative options. Understanding the importance of early detection, ask directly, what is the likelihood of detecting something like pancreatic cancer at this stage? Being an advocate for your health means pushing for thorough evaluation and not settling for quick answers. If you feel your concerns are being overlooked, seeking a second opinion can be a vital step in ensuring your health is being taken seriously. Risk factors and importance of awareness. Understanding your personal risk for pancreatic cancer isn't about living in fear. It's about staying informed and prepared. While this disease can affect anyone, certain risk factors can increase the likelihood of its development, and being aware of them allows you to stay vigilant long before symptoms appear. Family history is one of the most significant indicators. If a parent, sibling, or close relative has been diagnosed with pancreatic cancer, especially at a younger age, your own risk may be elevated. This is particularly true in families with histories of genetic mutations such as BRCA1, BRCA2, or Lynch syndrome. Knowing your family's medical background can help you and your doctor make more proactive decisions about screening and surveillance. Lifestyle also plays a key role. Smoking, for example, significantly increases the risk. Research suggests it may double the chances of developing pancreatic cancer. Chronic pancreatitis, a long-term inflammation of the pancreas, is another condition linked to higher risk, particularly when it's related to alcohol use or inherited disorders. Even type 2 diabetes, especially when newly diagnosed later in life, may serve as a subtle early warning. Being aware of these risk factors empowers you to take control of your health. It encourages earlier conversations with your doctor, closer monitoring of subtle changes, and, if necessary, more timely testing. Awareness is not just about prevention. It's about positioning yourself to act early should warning signs appear. In the case of pancreatic cancer, that awareness could be life-saving. Prevention tips and lifestyle adjustments. Once you understand the risks, the next step is shifting from awareness to action. While not all cases of pancreatic cancer are preventable, certain lifestyle choices have been shown to reduce the likelihood of its development and increase the chances of catching it early, should it occur. Many of the same habits that support heart and metabolic health also protect the pancreas. A diet rich in fruits, vegetables, whole grains, and lean proteins helps reduce inflammation in the body and supports overall digestive function. Studies have linked high consumption of processed meats and added sugars to increase pancreatic cancer risk, making moderation essential. Subtle. Consistent dietary improvements often provide long-term protective benefits, especially when paired with reduced alcohol intake and smoking cessation. Exercise plays a role as well, not only in managing weight and blood sugar, but in supporting immune function and reducing chronic inflammation. Even moderate daily activity, like walking or cycling, can make a significant impact over time. But lifestyle changes aren't only about prevention. They also help build a baseline of health that allows symptoms to be more easily noticed if something begins to shift. This makes regular health screenings and proactive medical checkups even more valuable. For those with family history or other high-risk indicators, genetic counseling and early imaging may be recommended, even in the absence of symptoms. Empowerment through prevention means knowing that your daily choices matter. It means aligning your habits with vigilance, so that your health never has to rely on hindsight. From the subtle onset of unexplained weight loss to the more visible signs like jaundice and darkened urine, the body often speaks in whispers before it cries out. You've now seen how 6 key symptoms, weight loss, abdominal or back pain, sudden changes in blood sugar, yellowing skin, digestive disturbances, and unusual stool or urine color, can quietly signal pancreatic cancer before it becomes urgent. When these signs are brushed aside, the window for early intervention narrows. But with vigilance, awareness, and prompt action, that window can remain open long enough to change the outcome. If you or someone you love is experiencing any combination of these symptoms, don't wait. Speak to your doctor. Push for the tests. Trust your instincts. And if you're unsure where to begin, seek guidance from trusted health organizations. Taking action today could mean a very different tomorrow. You have the knowledge. Now use it to protect your future.